Actinomyces Israelii is a species of bacteria, represented in this Picmonic by the acting mice. These bacteria stain gram-positive, shown by the graham cracker positive angel, and are rod-shaped or bacillus-shaped, explaining the rod in the image. Actinomyces Israelii bacteria prefer to grow in an environment void of oxygen as they are anaerobes, illustrated by the ant in her robe. These bacteria are unique in that their colonies grow as branching filaments depicted by the branches. Actinomyces is a normal flora of the oral cavity, illustrated by the oral flowers, and because of this, these bacteria can cause infections during dental work, the mice drilling the teeth, or during oral trauma, which is also represented by the drilling of the teeth. Additionally, these bacteria are associated with the use of IUDs, or intrauterine devices, shown literally as the IUD in the image. As a consequence, Actinomyces Israelii is associated with genitourinary infections, which is why we show the uterus. Furthermore, these bacteria can cause draining sinus tracts of pus from the source of infection, illustrated by the long tracts that the mice are burrowing through. If untreated, these tracts can progress to facial abscesses, shown as the abscess guy in the face. On gross examination, this bacteria species can demonstrate characteristic yellow clumps of bacterial colonies that resemble yellow sulfur granules, depicted by the yellow granules. We treat Actinomyces Israelii infections with a high dose of oral penicillin, the pencilvillain. So to sum it up, Actinomyces Israelii is a gram-positive bacillus. These bacteria are anaerobes and grow as branching filaments. They are part of the normal oral flora and can lead to infections after dental work or oral trauma. Actinomyces Israelii is also associated with IUD use. It can be the culprit in genitourinary infections, and in orofacial infections they can form draining sinus tracts. If left untreated, these can progress to facial abscesses. On gross examination, these bacterial colonies resemble yellow sulfur granules, and don't forget that actinomyces infection should be treated with a high dose of oral penicillin.
Efficient, effective, and research proven to increase exam scores.